having a fistula, really only the patient knows the pains that go with that. But I can tell you that I had a 15-year-old patient that had several small bowel fistulas after a motor vehicle crash, and he literally had to wear, a fistula pouch to his junior prom. And he said, I went in early that day so I could put a fresh one on, because every day, they're holding the contents of their bowel on a pouch on the outside of their body. And so even with the best wound care, there's always an odor to it. And for a 15-year-old boy in high school, having an odor like that was really isolating. And he definitely has told us that he was very depressed during those months that he had his fistula, and he had to homeschool, so he kind of missed that whole year of his school, which is very hard. And I've had another patient that had a fistula, and he was in his phase when he was waiting to have his surgery, and he ran out of dressings and had to use a trash bag and some duct tape. And he did tell us after he was repaired, which it's unfortunate that we had to know that after he repaired, that he actually was going to commit suicide one night. And because, he had this terrible problem and he couldn't contain it, and he kept running out of dressings, and he was just very depressed. And so I think that the fistula world, the fistula care that we give, and the ability to allow them to live a little bit normal life during that waiting period is truly a gift. The journey to the final surgical repair for a fistula patient is a long one. It's generally 12 months in time, hundreds and hundreds of dressing changes and pouch changes. And so what we tell them is, once that wound has contracted and the skin has grown over it and their scar is there, if they can pinch their scar and pull it between their fingers and roll it between their fingers, it means that it's no longer adhered to the bowel. And that allows the surgeon to enter the abdomen without, by accident, going into the bowel where he wasn't intending to do so. So we say passing the pinch test is what that is. So they pinch their scar, and if they can roll it between their fingers, that means that they're probably ready for surgery, and then we start to prep them and get them ready for surgery. But it's cute because they come into clinic and they whip their shirt up and they're like, look, I'm passing the pinch test. It's time for my final surgical repair. So it's always a good day when you pass the pinch test.